Hello guys, welcome to my channel DeToX with DeToX. Today we'll be discussing about bedside safety checks in critical care unit. Let's go. Let's start with what is bedside safety checks. A bedside safety checks is one of the most essential tool consists of different checks performed by a registered nurse to make sure that our patients are safe and we are doing everything to create a safe environment for them as well as for us and our colleagues. It can be also called as handover checks or safety checks. Now, when we should do a bedside safety check, every unit has a different protocol about when it needs to be done. As it is also called as handover checks, it should be done as soon as we finish our handover. But sometimes it's not possible because if your patient's condition is critical, your first priority will be to stabilize that patient and then crack on with your safety checks or handover checks. If it is done in the beginning of the shift, it gives us enough time to make sure that anything which is not available shall be replaced or to find out any fault in the surrounding equipments. It is very necessary, it should be done as soon as possible to make sure that you are working in a safe environment. Now, how frequently we should do these bedside safety checks? Everyone has a different way of working and they will do things differently. As per the current trend, it is done once in a shift, mostly in the beginning. But I would say it should be done in the start of the shift after you have been away from your patient for some time, for example, going for your breaks. And also it should be done after transferring a patient out of the unit and back, for example, scans or any other procedures. The reason behind this is once you are away from your patient or during a transfer, we don't know what has been changed in your bed space. Anybody has come or made any changes, took any needed equipments, etc. So to ensure the safety of your patient, especially if any emergency arises and you don't find an equipment which was initially there in your bed space, it is better to do it when needed. Again, not every day is same and you won't get a chance to do it on every occasion, but whatever we can do to ensure our patients are safe, we should do it. Now the most important thing, what does a safety check consist of? Let's get into detail one by one. There is no sequence to which check should be done first unless it's all been done. The most important factor, we have to do all the checks. I personally start with the patient ID band. One of the most important check which will notify you that you're working with the right patient. Depending upon your patient, whether level 2 or level 3, the first thing we do is greeting the patient, self-introduction to them and orientation about the environment. So this is the best time to confirm their ID band details and check their allergies. Sometimes you will find that your patient is allergic but have a white ID band or doesn't have an allergy but have a red ID band. So once this is known at the beginning of the shift, it can save our patient from any near misses or any wrong administration of drugs or any other procedures. Hence, the checking of ID band carefully is of prime importance. You can request your ward clerk or nurse in charge or any senior personnel to get you an ID band. As soon as you find out that your patient is not having an ID band, we have to make sure if we do not have an ID band or any of the details in the ID band are incorrect, we cannot proceed with the procedure. We need to have an ID band before doing any task for the patient. The next check is alarms. I always say alarms are your best friends. To start with, we have to make sure that alarms are on. Under no circumstances your alarm should be off, as it can be detrimental for the patient and can compromise patient safety. Very rarely, due to situation like end of life or palliation, alarms can be put off, but it has to be documented properly. Once we check that alarms are on, we have to set the appropriate alarm limits. Now, appropriate term comes because alarms need to be set individually. Let's take an example of heart rate. We know that the normal heart rate ranges from 60 to 100 beats per minute. But if we set the lower limit of 60 and the upper limit of 100 for a patient whose normal heart rate remains at around 50 to 55, the alarm will keep on beeping and you will be frustrated, your patient will be troubled because of a constant alarming, and you cannot concentrate in such environment. So it has to be set appropriately and individually. General alarms include heart rate, blood pressure, arterial or non-invasive, respiratory rate, CBP if applicable, EtCO2 if applicable, and saturation or any other monitoring present. Also, if a patient is on ventilator or renal replacement therapy or attached with a cardiac monitor, we have to set alarms or do the setting as per the requirement for the other machines as well. Next comes checking of oxygen flow meter. Checking of this will help us to make sure that there is no leak present and it's in working condition. If a patient is on oxygen, don't forget to check the connections for kink, as sometimes it might not be delivering properly. Make sure this white connector is always attached to your oxygen flow meter, because even if your patient is not on oxygen, you will require this during an emergency. Next comes oxygen cylinder. Each bedside comprises of a portable oxygen cylinder which is used to transfer the patient, also act as a standby in case of any central oxygen failure. When we check this, we have to make sure the level of the oxygen is always more than half, and if it's low, change the cylinder immediately. Also, if you're planning to transfer your patient for any scan or any other procedure, make sure that the oxygen cylinder is almost full, because you don't know how much time it will take. In case of an emergency, you will need this oxygen cylinder. Next, we will look for the position of the bed. Bed should be always set as lowest position to help mobile patients for easy transfer between the bed to chair and give them support while seated at the edge of the bed, and also to reduce the harm with falls, as some patient with delirium may unintentionally or intentionally can fall. Position of the bed changes while doing any intervention. Height can be adjusted as per your manual and handling protocol, but need to be set as lowest position after the intervention is finished or the procedure is over. Also, while checking the bed, make sure that the head end of the bed is elevated more than 30 degrees for all the ventilated patients. The next comes ambu bag with anesthetic mask, which is very important for every transfer. Also comes handy in case of providing manual breaths before intubation, or can be used in ventilator failure. We have to make sure that each set comprises of an extra tubing which will be connected to the ambu bag while giving manual breaths, so that it will provide an extra oxygen support. We also have to make sure that the size of the anesthetic mask is important, as it should match the patient. We can't keep a large mask for a small patient or small for a large patient. Please check the mask appropriately for your patient. Next, we will check for a non-rebreather mask, which is usually kept in the same set as ambu bag. This is also very important for the patient if a patient deteriorates or sudden increase of their oxygen requirement. It can also be used instantly if a patient self-extubate himself. You can just put on this mask, put the oxygen on 15 liters and connect with the patient till the medical team arrives. Next, we will check is the suction source. The suction source should be in working condition and the pressure should be set appropriately. It should not exceed more than 200 mm of Hg in adults. Only in certain cases, if you have to remove the thick secretions by suctioning, you can increase the pressure, but make sure you reduce it back. There are two types of suction which we use in the unit: high vacuum suction and low vacuum suction. Bear in mind that high vacuum suction should not be used for chest drain. Low vacuum suction are specially made for the chest drain because we don't require higher suction pressure. The suction set should be changed every 72 hours, including the yellow tubings, the filter, the tubing which connects to the patient, and the closed suction if applicable. Next to check is transducer fluid. If available, we have to first make sure that the correct fluid is running, which is normal saline 0.9%, a 500 ml bag. Under no circumstances, the fluid will change to any other fluid. It should always be normal saline 0.9% 500 ml bag. We should also check whether the level of the fluid is sufficient. If not, change the fluid bag. We also have to make sure it's dated and signed. A transducer set can be used for 96 hours. Once you have checked all these things, the next step will be zeroing of the transducers, whether it's central venous pressure or the arc line. Both have to be zeroed. Next to check is green anesthetic bag with HME attached. This is also called a water circuit or Mapleson circuit, or simply a breathing circuit. This can be used before an intubation to provide 100% oxygenation to your patient. It can be also used in case of a ventilatory failure. Disconnect the patient's source from the ventilator and connect this. Make sure it's attached with the oxygen source first and it is connected to the patient like an ET or tracheostomy tube. Then you can start giving manual breaths to the patient. Also, sometimes it can be used for manual recruitment of lungs and can be used for suctioning as well for the removal of thick tracheal secretions by providing extra pressure. The circuit has to be connected with oxygen flow meter and checked for any leak and proper inflation of the bag with adjustment of PEEP. Make sure in your shift you are doing these checks. Also, one of the most important thing which we miss is the size of the bag. For every adult, it has to be 2-liter bag. We cannot use small bags for an adult patient. But remember, you can use a big bag for a pediatric patient by providing less pressure on the bag. Next check is, if your patient is on wet ventilatory circuit, we have to check that the proper humidification is in place. For example, in wet circuit, we use Fisher-Paykel as a humidifier. We have to check that the Fisher-Paykel humidifier is on with proper temperature. If it alarms constantly, do not put it off and keep it like that, because the ventilator will not provide any humidification to the patient. You can turn it off and turn it on immediately to check whether it is alarming again or not. If it alarms, you have to check the other 2 wire, which is the heated wires present in the Fisher-Paykel, disconnect it and reconnect it back and see whether is it alarming. If it's still alarming, you might have to consider changing the Fisher-Paykel set. Next to check is all the infusions which your patient is on, whether the infusion is correct, dated and co-signed. Make sure that the set and manometer lines are dated so that we can reduce the chances of infection and other complications. All the infusions need to be prescribed, and you can also check whether the rate of infusion matches the documentation. If in doubt, feel free to talk to seniors for seeking advice.
When doing the bedside safety checks, if you are not familiar and confident with any device or equipment does not belong to critical care unit, please report it to nurse in charge immediately. It's unsafe to use an equipment which you are not confident or which does not belong to your unit.
Next comes decluttering and damp dusting of your bed space. It's our duty as a nurse to make sure that bed space is safe and free of any clutter. It should be safe for us to walk around and perform necessary interventions. For that, we have to declutter the space first. All the non-necessary items or equipments need to be cleaned and removed from the bed space, which not only makes the bed space looks good, cleaner, it reduces the chance of infection and saves us from tripping or falling. Once we have cleared all the things from the bed space, we have to do the damp dusting and cleaning with Chlor-Clean as per protocol to prevent any infection as much as we can. These are the basic checks which we generally have to perform for any patient in critical care unit. Other than this, if a patient is connected with other monitoring, for example BIS monitoring, cardiac monitor, or attached with any other machines like nitrous oxide, CVVH, we have to make sure that these are arranged in the bed space in a way that we have enough space to move around easily in case of emergency. Sometimes it is difficult to have all these in your bed spaces, but we have to utilize the resources as available. Also, in the bedside safety checks, there will be some variants depending upon level 2 or level 3 patients, like an airway display mentioning the grade of intubation and mentioning the name of the person to call in case of airway emergency and who to contact. It's very crucial. For all the patient with tracheostomy, emergency trachea box need to be kept ready in every bed space. This includes same size tracheostomy tube, half size smaller tube, inner cannula or tube same as size of the trachea in situ, tracheal dilators, securing tapes, 10 ml syringe, stitch cutter, lubricating gel, bed head sign displayed. These all things we have to make sure that it is available for patient if they have a tracheostomy tube in situ.
Addition to this, if you are working in MRI ICU side rooms, you will also check for ski sheets under the mattress, which will be used in case of fire to transfer the patient.
Things will change according to different patient and different settings. This was just to give you a brief idea that how a bedside safety check needs to be done. You must be knowing already by now and you must be performing in your daily task. But make sure whenever we perform any task as a nurse, we have to make sure that patient safety is most important. Please feel free to post in comment section about any doubts regarding this topic or anything else. We will try to include all the doubts, all the topics which you have mentioned in comment section to make sure that you are clear about it. And we will include those in our next session. Please share this video as much as you can so maximum people can be benefited. Subscribe our channel and press the bell icon so that you will be notified for any of the new videos. Hope you have enjoyed this session. Thank you for listening. Goodbye. See you in next session of DeToX with DeToX.